A hearty good evening and welcome to a session on schools reopening and how do we take care of our children's health. We are glad to have Dr. Sharmila Pendyala among us today to help us explore this topic. As schools reopen, many parents are anxiously awaiting to understand whether it's safe or not to send kids to school, and whether schools are offering remote learning options. Parents are unsure whether it's safe to send their children back to school for many reasons. So, today we are here to help you with some day to day safety tips, precautions, and more. You may also feel free to ask the doctor any questions you have related to the topic. So, doctor, you have the stage.
Okay, so I'm Dr. Sharmila Pendyala. I am a senior consultant pediatrician with Apollo Group, Apollo Cradle, Jubilee Hills, and Apollo Hospitals, Jubilee Hills. So, I think last 2 months, I would say, the outpatient inflow has increased, and most of the patients that I see outpatient are coming up with fever along with other varied symptoms. Some of them are coming with fever, cold, and cough. Some of them only with fever. Some of them with fever, vomitings. Some of them with fever, loose motions. But this fever thing is pretty much common in, say, I would say it wouldn't be an exaggeration if I say about 6 to 7 children out of the 10 that I see are coming up with fevers. And interestingly, last 2 months, the same child is coming back 2 to 3 times. While the very same child, I usually follow up most of the children right from birth, never would visit me more than once or twice a year with fever. Just in these 6 to 8 weeks, it wouldn't be an exaggeration if I say that they have visited twice or thrice, couple of them. And for most children who never would come to me with fever for more than a day in a year or maybe once in 6 months, are also coming up with temperatures. Some children as high as 105, not 100.5, 105. So this has become almost a routine to see children with fevers. And I would share with you the usual questions that I get from parents. Probably those are the questions which most of you, if answered, would be benefited from. So the first thing, the quintessential question is it okay to send to school? Why is it this question asked about? Obviously because we are just out of the lockdowns, then various restrictions. In between, we even had a mask mandate also loosened up, and all these changes that happen. So everyone wants to know, doctor, is it safe to send my child? Particularly because the adolescents also, in fact, are immunized against COVID, very freely available COVID vaccination. Then these little ones, less than 5 particularly, then less than 10 most of the times, they are unimmunized against COVID. And how safe is it to send my child to school without getting immunized is the first question. For that, the answer remains, in the present scenario, with all the precautions that you are told, probably I wouldn't think it's a sacrilege to say that having that risk of getting COVID is still better than having the child at home miss all the classes or go online. The reason being, the after effects of being socially isolated, go taking online teaching, are worse than the mild attack of COVID that many a child is facing. So this is, I think I can say this with quite some conviction that you better send your child to school. But then you have to know a couple of things while you're sending a child to school. Greater than 5-year-olds, ask them to wear a mask. Then hand washing is definitely a must. Hand washing is a must. The third thing being, if your child is unwell, please don't force a child to go to school because he is functional. He is unwell, but yet functional, so he better go to school. No, don't do that. You're harming the community. And approach a doctor on day one or day two of fevers, online or offline. Now you have this enormous online reach for doctors. Even I am, for example, on Apollo 247, right from 7 a.m. to 10 p.m. That's quite a lot of time that, I mean, I am available. So almost many of your pediatricians are available online. So make use of that. Just because I assured you going to school is safe doesn't mean that you will be complacent. There's a difference between the two. I mean, how are you not going to be complacent? When your child is sick, you don't take a call on whether it's mild, moderate, or severe sickness. No. Child is unwell, just approach your medical professional, online, offline, whichever way. One consult that won't harm you or the child in any which way. They will tell you the warning signs, and then you follow up with your doctor as needed. And don't be surprised if your child who's never fallen sick is falling sick now. Never fallen sick or very rarely fallen sick now, having repeated fevers. This is the norm right now. Because why is it happening? It's because we have opened up of 2 year of cocooning ourselves in various degrees. So you would have lost, most of us would have lost immunity to the usual circulating viruses. You need a booster. Booster means exposure to them. So that's what is happening right now. And because your immunity is low now for specific kinds of circulating viruses, you are falling ill and then gaining your immunity, in a way, getting immunized, what I would say. And after these 2, 3, or 4 episodes of fever, your child will get better. But as I said, don't be complacent. You approach your doctor. Then, what is the next thing that I would want to share? What are the circulating viruses now? What are the kind of illnesses that are going around? I would say back here in Hyderabad, which is most of the times relevant all across India, we are seeing a surge in COVID cases. We are seeing a hand, foot, and mouth outbreak everywhere. Though first brought to the limelight in Kerala, we actually see hand, foot, and mouth almost every year in hordes. This year, what is little unusual is hand, foot, and mouth is coming back with a little more severity, but then you don't have to worry. There will be rash in the throat, butt, elbows, knees, hand, palms, and soles. But it's very much manageable with symptomatic treatment. Rarely a child, I probably admitted two of them, with very high grade temperatures with dehydration because they had difficulty in swallowing and they were not taking orally, which causes dehydration. Other than that, most of the hand, foot, and mouth we treat in outpatient. In fact, every year we treat 100% outpatient. Though there are some described complications, we hardly ever saw or will see, except for dehydration, because when they don't take orally. So, this message is valid even in this season, any other season. Your child falls sick with fever. What is the concern? Most important primary concern, whether it's an infant, it's a toddler, it's a 12-year-old, or any other age. Hydration is the key to get out of fever. Your medicines also won't act if you're not hydrating your child well. So, what is the commonest mistake that parents do? They are behind their children to eat even when they're unwell, forgetting pretty well that you are not eating well when you are unwell, but you want your child to eat well. How is that? What is that? So you have to be concerned about hydrating your child rather than coaxing him to eat and eat and eat. It doesn't matter. Let him lose a little weight. He's going to gain that back once he's back to his normal health. But then if you don't hydrate him, this is going to cause emergencies. If you're not hydrating your child, just give water, lots of water, and rest. That's it. The hunger of your child will guide him to ask for food. He's not asking for food, leave him alone. But don't leave him alone even if he doesn't ask for fluids. because you are supposed to mandatorily hydrate this guy. So that is the most important thing I would want to the parents to know. Hydrate your child well in fevers. And coming back to the various viruses I was talking about, and hand, foot, and mouth, there is a little, definitely a lot of rise in dengue cases. And that again comes in a myriad of manifestations. Dengue can come with bronchopneumonia, like you can have a fever, cold, cough. Dengue can come like an acute abdomen. You can have fever, severe abdominal pain. It can come up with fever, vomitings, and loose motions. It can come up with fever and fits. So you name it, and that is one of the manifestations of dengue. So you will never know what it is. Just approach your doctor the moment you have a fever. In case you do not have a fever and have one of those other things that I told you, still take a doctor's advice. You will be surprised to know dengue. I have seen many cases of dengue with just 100-degree fever, and couple of them even without any obvious fever recorded. So it is a popular misconception that dengue should have very high grade temperatures. No, 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 and no. But it will be heartening for you to know that 90% of cases of dengue are treated in the outpatient. Only 10% will need hospitalization. But it is for the doctor to decide which one to hospitalize and which not to. So these are some of the things. Then there is a rise in typhoid cases in unimmunized children. I haven't seen a case of salmonella in an immunized child. So if you are lagging behind with your shots, please go and take those shots. Salmonella outbreaks are very commonly seen in the last 6 months in adults because we as children were not immunized against typhoid, then against adolescents or children who are unimmunized. So go and catch up with your vaccination. And like I said again, even if at the cost of sounding very repetitive, every fever, just take your medical advice. And the other virus is there is a hepatitis also, like certain viruses, almost all viruses will raise the liver enzymes to a certain extent. We don't check every fever with a liver function test, but then there are certain viruses which have a propensity to attack a liver a little more preferentially. So we are seeing a rise in hepatitis cases also, not uncommon. We are also seeing respiratory syncytial viruses, couple of arboviruses, all these. And in some people who travel into the wild or even otherwise into remote places, they are getting afflicted with rickettsial infections, which again presents with fever, rash sometimes, which you might not appreciate, and the usual symptoms, body pains, fatigue, all these things, vomiting sometimes. So jaundice cases, hepatitis A has had an increased, all these things present sometimes, most of the time, with fever. So cases of fever you do not neglect. Take your doctor's advice. Hydrate your child. That doesn't harm any time. But if the child is unrelentingly having some other symptom, even if it's an older child, take medical help. Don't ignore fevers. That's all. Having said this is not to frighten you. This is not to keep your child away from school. No, I'm a strong advocate for sending children to school because I have seen more damage done to teenagers or even younger age group children. Younger age groups, there are mood changes. What you think they're acting cranky, they're not eating, could be anxiety and depression in them, and learning difficulties because they have not gone to school for 2 years. The older group has more of mental health issues. I've seen a lot of rise of anxiety, depression, suicidal tendencies in teenagers. So encourage all children to go to school, but seek medical help whenever they are unwell. So this is what is the take home message. And what are the other things that as always, it's raining everywhere. Prevent mosquito bites, use mosquito repellents, have mosquito nets, sleep under the mosquito nets. Other than that, wear full clothing. In fact, I actually ask most of the school authorities to make it mandatory to wear pants to school, I mean trousers to school, rather than half skirts, or even if you wear a skirt, wear something underneath like a tights, and all boys wear trousers. Even the younger age group, little fellows, should wear full pants. This will prevent dengue, because dengue is a daytime biting mosquito, and then it bites below the knee, and hence most of the bites happen in schools. Couple of them happen at home too. And malaria is also on the upsurge. Malarial, or the mosquito which spreads malarial parasite, bites in the night, while dengue is more of daytime biting mosquito. Dengue is spread through daytime biting mosquitoes. So, and this, and universally, water that you drink is extremely important that it is sterilized. So both UV and reverse osmosis, whichever purifier has both these things, these are the purifiers you have to opt to be fixed at your home. Whenever in doubt, boiling is extremely the safest way to ingest water is boil water. It remains the age-old practice. So that will ensure that you won't get waterborne illnesses. Don't drink water outside where you do not know the source it's coming from. When you eat outside, prefer to eat hot food, freshly cooked food, even if it's in the restaurant. It has to be piping hot when it is served to you, and then obviously you'll eat. So this will prevent, to a certain extent, minimize the amount of eating you're doing outside in a rainy season, where waterborne, foodborne illnesses will be on the rise, both summer and winter, in fact. Rainy and summer, I would like to correct. So, winter again, it brings in a horde of allergies coming back. I've got a couple of the children with asthma, with allergic bronchitis coming back with coughs. So, go back to your preventive medication in case you're on Budicort inhalers or fluticasone inhalers. Take your doctor's advice and then go back to your maintenance therapies, because the weather has changed. Your child might start reacting again. So, this is what it is. These are the usual things that I usually want parents to take care. And irrespective of the school reopening, irrespective of the weather, I've also observed that many children with special needs, they've fallen out of their therapies. Go back to your therapies, even if it is at the risk of contracting one or two fevers, one or two colds and coughs. You're losing now. 2 years is a long time. If you have discontinued your therapy or you're taking it only online, go back to offline therapies. They are more effective than online therapies. But if you're in a place where you don't have access to offline therapies, online therapy still is good. But this popular misconception that sending back to school or putting a child in school will in itself act as therapy, I would want to debunk that myth. No, it doesn't do. For children who need therapy, you have to take therapy. Yes, sending to school will increase the social interaction, but it's not like therapy. It's not one in one. It is better than being left alone in a home without much stimulation. Yes, school is better than that, but it will not match therapist. It will not match therapies. So you should go back to your therapies, offline therapies. So I mean, it's open to questions. I think you should make use of your time to pose any specific questions that you might have. I'm there for another 10 or 15 minutes to answer all your questions. So before I get any questions from the audience, I will keep telling you what are the usual things that probably I encounter day in and day out. So, about dengue illness, that is what is quite that is what is quite rampant right now. So, dengue illness, usually your child will be complaining of body pains. In fact, I see lot of children coming up with complaints of headache, body pain. Some of them complain of knee pain and watery eyes, feeling unwell, not eating, throwing up, high grade temperatures. And yes, I have seen actually children. I have seen children coming up with severe abdominal pain, severe abdominal pain coming up to the emergency, and so that's what it is, coming up to the emergency with severe abdominal pain, vomitings, sometimes with loose motions, and all those things. Don't think dengue will come up only with fever. No, it can come up as acute abdomen also. So any fever, take help. I've seen this season infants coming up presenting with dengue, coming up to the ICU with seizures, what we normally colloquially call as fits, throwing up a fit, high grade temperatures, with platelet counts as low as 15,000, while the normal is 2 lakhs and above. I mean, so that is one thing that we have seen. Rickettsial illnesses, yes, with high grade temperatures, with fluid seepage into the lungs and abdomen, both in dengue and rickettsia, coming with heart involvement, sometimes with breathlessness, lungs being filled with fluids. So this is not at all unusual. Keep your eyes open. And colds and coughs, don't dismiss them off. Take help. This could be the resurgence of your child's allergies. And if not for allergies, it could be COVID, it could be some other viral illness, it could be, for all that you know of, dengue, which is presenting with bronchopneumonia. So take help. Come to the hospitals or go online, seek your pediatrician's advice. Many a time it will be a simple viral cough cold or simple resurgence of allergy. But for those children who need that extra help, if it's getting into pneumonia, if it's getting worse, if you're getting breathless, then probably you will have to act on time. These are something sometimes parents might not recognize on their own. So probably you will, taking help from your pediatrician will always help, will always guide you in the right direction. If your child is copiously vomiting, many a time parents think it's only acidity. No, it can be that your a pancreas can be involved, it can be pancreatitis. All these recognition, a non-medical person will not be able to tell you, whether it's your own self, it's a parent or someone at home. So just take one consult and then we can sort you out. It could be a simple gastroenteritis presenting with vomitings and then going on to loose motions, or it could be some manifestation of COVID or dengue, or the other thing, like 4 to 6 weeks or 8 weeks after COVID, your child can be getting into multisystem inflammatory syndromes. In fact, one of the often asked questions is, Doctor, you're asking me to test for dengue, but COVID, but my child already had COVID last year. Interestingly, children who have had it once are having it twice and thrice. It's the same pattern in adults too. So somewhere down the line, your COVID immunity is not great shakes, and probably that's the reason. But then again, I am reassuring you, COVID in children is COVID virus has been very kind to children. It definitely doesn't cause much of an upheaval. And the recent strains are presenting more like upper respiratory croup, what we call croupy kind of illness, barking kind of cough, involving the voice box and trachea more than the lungs. So you don't have to worry, but then sometimes croup can cause breathing difficulty. So you should be ready to uh, take an anti-inflammatory shot like Decadron to arrest that in its path, not to make it worsen and get into breathing issues. Not every time you need to get your lung affliction to have a breathing difficulty. Sometimes your voice box and trachea also can cause you what we call stridor and breathing difficulty. So just seek an opinion, it won't harm you. And like I said, hepatitis, even that can present with vomitings, liver afflictions, gastrointestinal illnesses, jaundice, what is common man called jaundice, yellow jaundice. All this can present with vomitings. So which is what your doctor will know. So seek an advice. And these are some of the tips that I always wanted to share when you're sending your child back to school. So I think I've given you almost all the valid things. With this, probably, I think I would want to log out if there are no more questions. I'll give a 5 minute time for someone to pose questions, and if there is nothing coming up, I almost told you everything that you need to take care while sending a child to school. Again, I'm coming up with that what I wanted to emphasize, though it looks like I'm repetitive and reiterating. Send your child to school. Don't withhold the child going to school, but then don't send a sick child to school, and seek medical advice early. There's no need to fear at all. Most of the illnesses that are circulating now can be treated in outpatient itself if you go to your doctor early. If that if is there, that big if is there. So, with this, I think we will call it a day. So we are now going off air. For whoever hasn't attended this session, I think it is a recorded version. You can always access this on YouTube and post your queries. We will be answering you, even if you post a query later also. Thank you all.